Speaking of how long to store these, right? We had a registrant question here. How long can you store allogeneic stem cells to be viable? Like, how long are they viable in cold storage?
Well, I mean, this is one of these things where I feel like we all know the answer, but we still have to go through stability, right? Now, when you store appropriately, I think, we've shown this with umbilical cord blood. We've shown this with autologous products as well, right? If you process and store that product in vapor phase or, in an appropriate condition, I think the answer is really indefinite, right? But you can't say that, right? We can't go to the FDA and say, hey, we want a label that says we're good forever, especially because we are doing stem cell derived therapies, which is different than the starting material itself. But I would say that a cord blood unit that has been stored for 25 years is equally potent and viable as a cord blood unit that was stored for 1 year, right? So I think it's a hard question to answer, and you still have to do stability studies. But even once we've done, so one of our products is an expanded stem and progenitor cell product, not yet differentiated. And I think that product too probably has indefinite storage capability, right? But we still have to go through the process of doing expiration and stability studies.
Definitely agree there. From what we've seen, I'm very confident for up to 5 years, but I think our company has only existed for maybe 5.5 or 6 years. So that tells you a bit. I'm waiting on data.
We'll see if your answer changes in 20 years.